Hello, very good morning. Welcome to Breakfast with Dan Walker and Louise Minchin.
Headlines for you at 6 o'clock this morning. As England prepares for a major easing of lockdown restrictions, senior medics warn urgent action is needed to make sure the UK is prepared for the real risk of another coronavirus outbreak in the winter.
With just 10 days to go, there's still no detailed safety guidance for many businesses in England, which are expected to reopen.
We'll be live in Manchester to find out what your local boozer might just look like when it welcomes you back for that first pint since lockdown began.
Many in the tourism industry will be happy to have that reopening day. I'm on Blackpool Beach's comedy carpet, looking at whether laughter, sunshine and love from returning tourists will be enough to keep businesses happy.
Novak Djokovic apologises after testing positive for coronavirus. The world number one is the latest tennis star to be diagnosed with COVID-19 after playing at a tournament he had organised himself.
Good morning from Kew Gardens, where the temperature is already 15 Celsius. Today across England and Wales it's going to be hot and it's also going to be humid. Temperatures rising in Scotland and Northern Ireland. You won't see the real humidity until tomorrow. I'll have all the details at 27 minutes past.
Looks lovely out and about this morning, doesn't it? It's Wednesday, the 24th of June. The top story for you today. Health leaders are warning that urgent action is needed to ensure that the UK is ready for a potential second wave of coronavirus.
The presidents of the Royal Colleges of Surgeons, Nursing, Physicians and GPs have signed an open letter in the British Medical Journal calling for ministers to do more to prevent further loss of life.
This comes as the Prime Minister announces the biggest easing of lockdown to date in England. Here's John McManus with more.
The warning is stark. According to the health leaders, Britain is at real risk of a second wave of coronavirus and needs to undertake a rapid assessment in order to prevent further loss of life. In their letter to the British Medical Journal, they say that some of the infrastructure needed to contain a resurgence of COVID-19 is in place, but challenges remain, and they've called for a cross-party commission to start providing recommendations for all of the UK by August at the latest. It's essential, they say, in order for the country to get ahead of the curve. The letter comes a day after the Westminster government announced sweeping changes to the virus restrictions in England. Pubs and restaurants are set to reopen, but social distancing will be observed and staff will take customers' contact details in case they need to be traced to prevent a virus outbreak. Other venues opening on the 4th of July include museums and cinemas, and for the first time in months, couples will be able to tie the knot again, but only with 30 guests.
These precautions could include installing screens, making sure people face away from each other, providing hand washing facilities, minimising the amount of time you spend with people outside your household and of course being outdoors.
At that final Downing Street briefing, the Prime Minister also warned that the relaxations could be reversed. The Chief Medical Officer for England, Professor Chris Whitty, said there would be an uptick in the virus if the public returned to their normal routines. The published guidance, though, is limited, and many businesses are still waiting for detailed clarification on how to open safely. It's a thought echoed by Labour.
We're still waiting for the guidance for all these businesses who are supposed to be opening a week on Saturday. And some of that guidance is really business critical issue for those businesses, but it's also really important for the public to have confidence in going about their business.
And there's frustration among some businesses that weren't included in the July 4th reopening, like gyms. Leisure bosses say their facilities are vital to maintain immune systems and ward off the virus. Restrictions are still varied across the UK. In Scotland, the 2-metre rule remains in place for now. But the government in Edinburgh said it was very interested to see the scientific evidence that had prompted London to ease restrictions in England. The First Minister, Nicola Sturgeon, will provide more details about easing lockdown restrictions later today. While in Northern Ireland, as of yesterday, up to 6 people can now meet indoors. Shops and places of worship opened earlier this week in Wales, but the 5-mile restriction on travel remains in place. John McManus, BBC News.
Well, let's get more right now from our political correspondent, Nick Eardley, who's in Westminster for us this morning. And Nick, there's so much to talk about. Big changes, there's a letter from the BMJ and also so much more guidance that we're waiting for as well.
Yeah, absolutely, Louise. Morning. Big changes coming in England on the 4th of July. Things will start to feel, I think, a bit like what the government thinks the new normal is going to look like, with pubs open, with those new rules, with restaurants getting back open, tourism starting up again. So we are going to see some pretty big changes in just over a week's time. However, there was a real note of caution from the experts yesterday. It really struck me in that press conference last night that the Prime Minister was talking about caution. The Chief Medical Officer for England, Professor Chris Whitty, was saying if we don't take the mitigation measures, so the things that are supposed to stop us getting the disease again, even if we're within 2 metres of somebody, if they're not observed properly, then there could be another uptick in the virus. And I think that's probably what's behind this letter from health leaders today, saying we've got to be prepared and we've got to look towards what could happen if there is another peak of this virus in the winter. So, some optimism, something to look forward to next week, but also real notes of caution, that real warning from the government that we can't move too fast on this. And it's not all about to get back to normal. Things are still going to feel very different to how they felt before.
Nick, good to chat to you, and we'll speak to you throughout the programme. Thank you very much. And we'll also be talking a little bit later to the Business Secretary, Alok Sharma, 7:30 here on BBC Breakfast. And as Nick was saying, there's so much more detail that we need to know as well. Yeah,
lots to talk to him about this morning. Elsewhere, America's top infectious disease expert has warned that the US is seeing a disturbing surge in coronavirus infections in some states.
Dr. Anthony Fauci says the next few days will be crucial to stem the new outbreaks.
Let's get some more detail from our North America correspondent, Peter Bowes, who joins us live from Los Angeles this morning. Peter, nice to talk to you as ever. So just how bad are these numbers in the country?
Yeah, good morning, Dan. It is pretty bad. In fact, in more than half of all US states, the number of daily infections is increasing. Some places those spikes are very significant. In the states of Arizona, Nevada and Texas, all of those states have recorded records over the last few days. And in Arizona, some 80% of hospital beds there are occupied, and there are real fears that the healthcare system in that state could be overwhelmed in the next few days or weeks. And that's the kind of language, isn't it, that we were hearing back at the end of March and the beginning of April in relation to places like New York City, the epicenter of the outbreak in the States. Yet it is still a situation that exists now in other places around the country. The president was in Arizona talking about coronavirus, the coronavirus plague, as he describes it, which he said was going away.
Peter, thank you very much for that. That's the update on what's happening in America with coronavirus. Live from LA for you this morning.
Internet use has surged during lockdown, with adults in the UK spending a record quarter of their day online.
That's according to the communications watchdog Ofcom, which says the biggest rise was among those over the age of 65. Our technology correspondent Rory Kitland-Jones has more.
From cabinet meetings, choir practice to exercise classes, much of life has moved online over the last few months. The average adult now spends more than 4 hours a day connected to the internet, half an hour more than last September. Much of that time involves video, either watching it or using it to make calls to friends, relatives or colleagues we can't meet face to face. Video services are booming. The TikTok short video platform had 5.4 million visitors in January. By April, nearly 13 million were turning up. The video calls and games app House Party had under 200,000 users in January. By April, 4 million were using it. At the beginning of the year, under 700,000 people were having business meetings using Zoom. By April, 13 million were using it for everything from Pilates lessons to pub quizzes.
For many of us, this has become the new normal during lockdown, locked in front of screens of all kinds for both work and entertainment. And it seems this applies to all ages.
Often it is the younger people who adopt new technology first, whether that's smartphones or social media. But in this case, we've seen the use of video calling double during the pandemic. And for the over 65s, they've been embracing the new technology to reach out and spend time with grandchildren and loved ones, often using the technology for the first time ever.
The lockdown period has also seen a surge in creativity. Making videos for sites like TikTok, YouTube and Instagram is now something the majority of children over 8 say they do every week. Rory Catlin-Jones, BBC News.
The government is to spend over £100 million to help homeless people in England stay off the streets.
A scheme to provide emergency accommodation to thousands of rough sleepers during the pandemic was due to end in 10 days. But homeless charities and councils have urged ministers to pay for it to continue. Our social affairs correspondent Michael Buchanan has more.
Over one weekend in March, thousands of rough sleepers were taken off the streets to protect them from coronavirus. Most have been housed in hotels, which were closed to tourists because of the pandemic. Not only do the rough sleepers get shelter, but also access to healthcare and, where necessary, addiction support.
It's put me in a healthy situation, and you've got food, water. On the street you haven't got it. You've got to go look for it, so it's made a big difference.
The initiative has been widely praised for saving lives, but it was due to end early next month, with charities warning that thousands of people would be tipped back onto the streets. Ministers have now found £105 million to allow councils to continue to house the homeless, to the delight of campaigners.
Over the last 3 months, something incredible has happened where 15,000 people have had their homelessness ended. They've gone from the streets and night shelters into accommodation of their own in hotels and other forms of housing. And that's shown us that really homelessness can be ended. There's no reason why we can't see all of those people go into a home of their own and actually start to begin to see this as the beginning of the end of homelessness completely.
With many hotels set to reopen, student accommodation and private sector flats are expected to be used to ensure the homeless continue to receive the support the pandemic facilitated. Michael Buchanan, BBC News.
In the midst of the pandemic, we've seen organisers cancel or delay countless performances. But in Switzerland, a group of acrobats decided that the show must go on. Have a look at Swiss acrobat Freddie Knock, who has broken 3 records during the performance of support
Please tell
artists
me he's not walking up that
by,
cable.
I think he is, by the outbreak. He walked blindfolded, just to throw a little extra thing in there, at an altitude of 3,000 metres on the cable car at the Swiss ski
He's
resort.
not on the cable car, he's on the cable.
I mean, he's on a unicycle. Louise.
No. It's too much for me. I should have had a warning before that.
I don't think. Can I have a look at? Can I have a look at that again? Has he got any wires on him at that point? At the end there. I mean, that.
I'm not sure I want to know.
I don't think I can have my breakfast after that. I mean, that's what. So this is an altitude of 3,000 metres.
So there he's walking.
There he's he can't see. What is he doing? Right, now watch carefully when he's on his unicycle to see if he's got any wires on him, because that is
still walking there.
Terrifying. Hold on, here it comes. Let's have a little look. I don't think he has.
Anyway, what? Next time I see that, next time we do that, at least I'm now warned. I'm not very good with height, even when I'm not looking at myself.
I've got sweaty palms.
Some people are a lot braver than we are.
Yes.
And let's be say brave.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.